Hi guys, welcome to our Hair Talk. I'm so excited to be here. I'm so excited to have you here. Welcome to our Hair Talk where we talk about everything women's health, women's lifestyle, women's wellness. This is kind of stuff you're interested in. Please do like this video, share, subscribe, and let's have more people join you. My name is Odako Yokoyemi. I'm a physiotherapist. I'm also a women's health enthusiast. And on today's channel, we're talking about something that is very prevalent amongst women. We're talking about dysmenorrhea. What is dysmenorrhea? The different types of dysmenorrhea, how you can distinguish whether you have the primary one or the secondary one, how to prevent it, what causes it. These are the kind of stuff we're talking about in this channel. So now, what is dysmenorrhea? Dysmenorrhea is the presence of a recurrent, cramp-like lower abdominal pain that occurs shortly before and during menstruation. It is what is popularly referred to as menstrual cramps. So when you hear people say, "Oh, I have menstrual cramps," that is the medical term for it, dysmenorrhea. Now we have two types of dysmenorrhea. We have the primary dysmenorrhea and the secondary dysmenorrhea. Primary dysmenorrhea is the kind of pain you feel without the presence of an underlying disease, condition, or pathology. While for secondary dysmenorrhea, it is menstrual cramps that happen due to an underlying disease or pathology or a structural abnormality within or outside of the uterus. Examples of these abnormalities include endometriosis, adenomyosis, or polyps or fibroids. How can I distinguish whether the pain I feel during my menstruation is primary dysmenorrhea or secondary dysmenorrhea? For primary dysmenorrhea usually starts within adolescence. That means primary dysmenorrhea starts within the ages of 13 to 19. So if you started feeling pain during menstruation while you were at age 13 to 19, then you probably have primary dysmenorrhea. Also, primary dysmenorrhea usually starts within 3 years of menarche. Menarche is the start of menstruation. So if you started feeling pain during your menstruation from the first 3 years when you started menstruation, then you probably have primary dysmenorrhea. Also, for primary dysmenorrhea, it starts shortly before menstruating, and then it peaks at the first or second day of menstruation, and then the pain lowers after about 72 hours. So if that is kind of pattern you have, then you most likely have primary dysmenorrhea. But for secondary dysmenorrhea, sometimes it starts from the first menstruation, but for most people it starts after the age of 20. So if you've had painless menstruation for a while and all of a sudden you started feeling pain while you're menstruating from the ages of 20 to 40 years old, then you probably just developed a secondary dysmenorrhea. Another characteristic of secondary dysmenorrhea is that it has little or no response to drugs. Most people tend to use NSAID, non-steroidal anti-inflammatory drugs, to relieve their pains during dysmenorrhea. But for secondary dysmenorrhea, they use these drugs and it has little or no effect on the pain they feel. So if this kind of pattern you also have, then you probably have secondary dysmenorrhea. Another characteristic of secondary dysmenorrhea is if it is accompanied with heavy and irregular flow. If you notice this pattern with your dysmenorrhea, then you probably have secondary dysmenorrhea. This is not a cause to fear. You only need to visit your gynecologist or your ex-practitioner who can help you diagnose it and then treat you accordingly. So now, back to primary dysmenorrhea. Primary dysmenorrhea is very prevalent. It will shock you to know that about 20 to 90% of women in the whole world go through some form of discomfort during their menstruation, and about 30 to 50% of teenagers have primary dysmenorrhea. So since you're not the only one, it happens to the best of us. So yes, what are the things you can expect during primary dysmenorrhea? You could have pain at your lower abdominal area. Sometimes this pain may radiate to your thighs, to your back, to your groin. It is normal, at least for primary dysmenorrhea. Sometimes you also have symptoms like headaches, nausea, vomiting. Sometimes it even causes syncope. It causes some people to faint. At least I've had an experience with someone I know that whenever she's on a menstrual period, she can't do anything. She literally blacks out. So yes, it is very prevalent and it is quite normal for people. It is also important to know that it is one of the most common gynecological conditions in the whole world, and is the leading cause of absenteeism in work and in school in the world. So if you have menstrual pain and then you can't do stuff, well, it is what it is. However, it is also important to note that a lot of women underestimate the pain that they feel during their menstruation, and then they feel it is okay and the pain is normal. No, you don't have to live your life every month in so much pain. There are things you can do to relieve the pain. There are things you can do to reduce the pain. Now, let's go back to what causes primary dysmenorrhea. So, what causes this pain during menstruation? It is caused by a change in the hormonal level in the body during menstruation. What happens during menstruation is that there is a slurring of the endometrial lining of the uterus. Now, the disintegrating endometrial cells now causes a production of the hormone prostaglandin. Now, this hormone prostaglandin, the excessive amount of prostaglandin in the body is what leads to the hypercontractility of the uterus. So you see that the uterus is constantly contracting. The hypercontractility of the uterus leads to an increased pressure and reduces the blood flow to the uterus. This causes hypoxia, which is lack of blood around the uterine muscles. Now, this hypoxia is now what leads to pain. So, prostaglandin increases the contractility of the uterus, leads to increased pressure, reduces the blood flow, and then leads to hypoxia, which will now feel as pain. Now that we know that we're not the only ones, now that we know that it is quite common amongst women that menstruate, now what is left is how can I manage it? How can I prevent it? And this is what I'm talking about in my next video. So do well to subscribe, and then more content coming up on Dysmenorrhea. Have a wonderful time. Bye.